Mitral valve prolapse. Mitral valve prolapse, MVP, is a heart condition in which the valve between the left atrium and the left ventricle, known as the mitral valve, doesn't close properly. In MVP, the valve's flaps bulge, prolapse, into the left atrium, which can cause blood to leak backward into the atrium. MVP is a relatively common condition and often doesn't cause any symptoms or serious problems. However, in some cases, it can lead to complications such as mitral regurgitation, backflow of blood into the left atrium, infective endocarditis, an infection of the heart's lining, and arrhythmias, irregular heart rhythms. Symptoms of MVP can include chest pain, palpitations, an irregular or rapid heartbeat, shortness of breath, fatigue, and lightheadedness. However, many people with MVP don't experience any symptoms. MVP is typically diagnosed through an echocardiogram, which is an ultrasound of the heart. Treatment for MVP usually involves monitoring the condition and managing any symptoms. In some cases, medication or surgery may be necessary to correct complications of MVP. Can MVP be cured naturally? Mitral valve prolapse, MVP, is a structural heart condition that cannot be cured naturally. However, many people with MVP do not experience symptoms and do not require any treatment. For those who experience symptoms, there are natural ways to manage the condition and improve heart health. Here are some natural ways to manage MVP and improve heart health. Maintaining a healthy lifestyle, eating a heart-healthy diet, exercising regularly, maintaining a healthy weight, and avoiding smoking are all ways to improve heart health and manage MVP. Managing stress. Stress can worsen symptoms of MVP, so it is important to find ways to manage stress. Techniques like deep breathing, meditation, and yoga can help manage stress and promote relaxation. Taking supplements. Some supplements, such as magnesium, may help manage symptoms of MVP. However, it is important to talk to a doctor before taking any supplements. It is important to note that natural remedies should not be used as a substitute for medical treatment. People with MVP should work closely with their doctor to develop a treatment plan that is right for them. MVP and teeth. There is some research that suggests a possible connection between mitral valve prolapse, MVP, and dental health. The connection is related to the risk of infective endocarditis, an infection of the lining of the heart, which can occur when bacteria from the mouth enters the bloodstream and travels to the heart. People with MVP may be at a slightly increased risk for infective endocarditis, and as a result, the American Heart Association, AHA, recommends that individuals with MVP take special care of their dental health. Here are some AHA recommendations for dental health for people with MVP. Regular dental checkups. Regular dental checkups are important to maintain good dental health and reduce the risk of infections. Antibiotic prophylaxis. Antibiotic prophylaxis may be recommended before certain dental procedures, especially those that involve bleeding, to reduce the risk of infective endocarditis. However, the AHA guidelines for antibiotic prophylaxis have changed in recent years, and it is important to talk to a doctor or dentist to determine if antibiotic prophylaxis is necessary. Good dental hygiene. Good dental hygiene, including brushing and flossing regularly, can help reduce the risk of infections. It is important to note that not all people with MVP require antibiotic prophylaxis, and the decision to use it should be made on an individual basis in consultation with a doctor or dentist. Arjuna powder and MVP. Arjuna powder is a popular Ayurvedic herbal supplement that is derived from the bark of the Terminalia Arjuna tree. It is used in Ayurvedic medicine to support heart health and may have potential benefits for people with mitral valve prolapse, MVP. There is some scientific evidence to suggest that Arjuna powder may help improve heart function and reduce symptoms in people with various heart conditions, including MVP. Some studies have shown that Arjuna powder may help improve the function of the heart's left ventricle and reduce symptoms such as shortness of breath and fatigue. However, it is important to note that there is limited scientific evidence to support the use of Arjuna powder specifically for MVP. While Arjuna powder may be a safe and effective supplement for many people, it is important to talk to a doctor before starting any new supplement, especially if you have a pre-existing medical condition like MVP. Additionally, supplements like Arjuna powder should not be used as a substitute for medical treatment. If you have MVP or any other heart condition, it is important to work closely with your doctor to develop a treatment plan that is right for you. Food to avoid with MVP. There are no specific foods that people with mitral valve prolapse, MVP, need to avoid, but it is generally recommended to follow a heart-healthy diet. A heart-healthy diet can help manage symptoms of MVP, improve heart health, and reduce the risk of complications. Here are some general dietary guidelines for people with MVP. Limit saturated and trans fats. Saturated and trans fats can increase cholesterol levels and increase the risk of heart disease. Foods high in saturated and trans fats include red meat, butter, full-fat dairy products, and processed foods. Increase intake of fruits, vegetables, and whole grains. Fruits, vegetables, and whole grains are high in fiber, vitamins, and minerals and can help improve heart health. Aim for at least 5 servings of fruits and vegetables per day and choose whole grain products like brown rice and whole wheat bread. Choose lean protein sources. Lean protein sources like skinless chicken, fish, and legumes are a good choice for people with MVP. Red meat should be limited and lean cuts should be chosen when consumed. Limit sodium. Excess sodium can increase blood pressure and put additional strain on the heart. Limiting salt intake is an important part of managing MVP. Aim for less than 2,300 milligrams of sodium per day. It is also important to limit or avoid alcohol and caffeine, which can increase heart rate and blood pressure and worsen symptoms of MVP in some people. Overall, following a heart-healthy diet can help manage MVP and improve heart health. It is always a good idea to consult with a healthcare provider or registered dietitian to create an individualized diet plan that meets your specific needs. Cause of MVP. Mitral valve prolapse, MVP, is a condition that occurs when the valve between the heart's upper and lower left chambers, the mitral valve, does not close properly. Instead of closing tightly, the flaps of the mitral valve bulge or prolapse back into the left atrium of the heart during each heartbeat. The exact cause of MVP is not fully understood, but it is thought to be related to the connective tissue that makes up the mitral valve. In most cases, MVP is caused by a problem with the connective tissue that allows the valve to prolapse. Some factors that may increase the risk of MVP include family history. MVP often runs in families and may be inherited. Genetics. Certain genetic disorders, such as Marfan syndrome and Ehlers-Danlos syndrome, are associated with an increased risk of MVP. Gender. MVP is more common in women than in men. Age. MVP is more common in people under the age of 50. Other medical conditions. Certain medical conditions, such as scoliosis and Graves' disease, may increase the risk of MVP. While the exact cause of MVP is not known, it is generally considered to be a benign condition that does not typically require treatment. However, in some cases, MVP may be associated with complications such as mitral regurgitation, which can lead to symptoms and require medical intervention. What is Graves' disease? Graves' disease is an autoimmune disorder that causes hyperthyroidism, a condition in which the thyroid gland produces too much thyroid hormone. The thyroid is a small, butterfly-shaped gland located at the base of the neck that produces hormones that regulate metabolism. In people with Graves' disease, the immune system produces antibodies that stimulate the thyroid to produce more thyroid hormone than the body needs. This excess thyroid hormone can lead to a variety of symptoms, including weight loss, rapid heartbeat, sweating, tremors, and anxiety. Graves' disease is the most common cause of hyperthyroidism and affects women more often than men. The condition can occur at any age, but it is most commonly diagnosed in people between the ages of 30 and 50. Treatment for Graves' disease may include medications that suppress the production of thyroid hormone, radioactive iodine therapy to destroy thyroid cells that produce too much hormone, or surgery to remove the thyroid gland. In some cases, treatment may also include beta blockers to help manage symptoms like rapid heartbeat and tremors. Graves' disease is a chronic condition that requires ongoing management and monitoring to ensure that thyroid hormone levels are maintained at a healthy level. With proper treatment and management, most people with Graves' disease can live healthy, active lives.